Differences between literature review and systematic review. Literature review versus systematic review. Definition 1 of literature review qualitatively summarizes evidence on a topic using informal or subjective methods to collect and interpret studies, while systematic review is a high-level overview of primary research on a focused question that identifies, selects, synthesizes, and appraises all high-quality research evidence relevant to that question. Definition 2 of literature review is an overview of current knowledge and theories of a specific topic, while systematic review is a type of review that uses analytical methods to collect and analyze secondary data. The function of literature review provides a summary or overview of topic, while the function of systematic review provides high-quality evidence. Literature review provides a questions with general topic or a specific question, while systematic review provides clearly defined questions. The number of authors in literature review are 1 or more, while the number of authors in systematic review are 3 or more. Literature review is used in social sciences discipline, while systematic review used in the biomedical and healthcare sectors. The components of literature review are introduction, methods, discussion, conclusion and reference list, while the components of systematic review pre-specified eligibility criteria, systematic search strategy, assessment of validity of findings, interpretation and presentation of results and reference list. The timeline of literature review are weeks to months, while the timeline of systematic review are months to years and average 18 months. The requirement of literature review is to understand the topic and perform searches of 1 or more databases, while the requirement of systematic review is thorough knowledge of topic, perform searches of all relevant databases and statistical analysis resources for meta-analysis. Literature review is not suitable for journal publication, while systematic review might be suitable for journal publication. The focus of review introduces context and current thinking, often without a specific question, is general and covers several aspects of a topic in literature review, while the focus of review uses a precise question to produce evidence to underpin a piece of research in systematic review. A standalone piece of research, it should be done by prior to undertaking further research, mainly in higher degree theses. The methods of data collection in literature review finds papers through a fairly random process, usually searching only a few databases. Use of grey literature common, but not usually systematic, while the methods of data collection in systematic review searches of several specified databases using precise search terms. A similar systematic search of grey literature sometimes included, depending on the question. The methods for data extraction for literature review in which papers are read, take-home messages used in the review, while the data extraction tool used in systematic review is to identify precise pieces of information. 2 or more researchers undertake data extraction. The methods for data presentation in literature review is prose paper, occasionally supported with diagrams, while the methods for data presentation in systematic review are Prisma and Consort or similar chart or table of included papers. The methods of data analysis in literature review in which the writer interprets the meaning of the results, while the methods of data analysis in systematic review that are recognized, referenced, methods for data analysis. Includes analysis of methods, rigor of conduct of research, strength of evidence, and so on. The number of papers included in literature review are anything up to 150 papers or more, while the number of papers included in systematic review are usually less than 50 papers, often fewer than 10. Literature review helps in identify the gaps between the current study with previous studies, while systematic review does not help in identify the gaps between the current study with previous studies. Literature review provides summary of literature on the topic, while systematic review connects practicing clinicians to high-quality evidence and supports evidence-based practice. The results of literature review are actions or directions informed by evidence of various kinds drawn from included papers, while the results of literature review are actions or directions are based on evidence from reviewed papers. Kindly subscribe my YouTube channel Thesis Helper. Thanks for watching.